Hi, my name is Gunnar Drossel, and I work in the lab of Dr. Anna Zilverstand at the University of Minnesota. I want to thank the Bell Museum for allowing me to give my talk for SciPride 2022. And this talk is titled Subtypes in Substance Use Disorder. So everyone is probably well aware that addiction has heavily impacted not only the United States, but the entire world. And I'm showing here a graph of just the United States with the percentages of people in 2020 who had a substance use disorder in the past year for those who are older than 18 years of age. And over 40 million people across the country have a substance use disorder. And as you can see, Minnesota here is in yellow, which is the second highest percentage bracket that this graph shows. So addiction is a very serious problem affecting millions of people in this country. This is partly due to how ineffective treatment options are that currently exist. And additionally, only a select few seek treatment. For example, with cocaine use disorder, less than 10% of people with this disorder seek any treatment. Relapse rates are very high across all drug use disorders. For cocaine use disorder, again, this is around 70% for those that have completed treatment. And there are some targeted treatment approaches that are in development, such as pharmacological options or drugs that can target different receptors in the brain to treat addiction. However, there's no comprehensive approach for matching someone with a substance use disorder to the different treatments that exist. And we know that different mechanisms drive the diagnosis for different groups of patients. And if we can group these patients into subtypes, we can assist in matching them to a specific treatment that's available so that hopefully their treatment is more timely and more effective. To give a better sense of what I'm referencing here, if we take this example, which is focused on stroke, but we could apply to addiction, we could take the population with the disorder or with the symptoms of stroke, look at their behavior, measure activity in their brain, and then we could delineate two different subtypes from within the larger population and go one step farther and look within these two types and see if the effects of certain treatment options would be effective for those within these different groups of people. So this example is for stroke, but we could apply this framework to addiction as well. So we took one sample, our first sample here at 173 participants with a past substance use disorder diagnosis. And we found when we measured on 12 different factors of their behavioral ability, as you can see here on the bottom x-axis of the graph, the scores from these different factors are on the left. We find three subtypes: a reward type, which has high sensation-seeking and risk-taking behaviors; a cognitive type, which has low cognitive openness and low IQ; and a relief type, which is high on scores reflecting negative affect, general psychiatric symptoms, etc. Then we wanted to see in a separate sample if we could replicate these subtypes. So this sample had 61 participants with current cocaine use disorder, and they were assessed on similar mechanisms. However, the scales were different, as you'll see along this x-axis. So the specific items and measurements were slightly different, but the mechanisms of behavior were similar that they assessed. We wanted to see if the three subtypes I showed on the previous slide replicate in this sample. And we see here that a cognitive and a relief type appear in this sample as well. So these two we confirmed do replicate. However, the reward type we saw on the previous slide does not replicate. And instead, we still have a third type. However, we're calling this type non-impaired. As you can see, these gray bars, they're low across almost all of these measures of impairment. So we're calling them a non-impaired subtype. However, because we can still replicate two of the subtypes in a different sample, and this one has people with current substance use disorder as opposed to the previous sample, which had past substance use disorder, our results overall warrant the development of personalized addiction treatments that are more individualized, that take into account these individual differences on the multiple mechanisms of behavior that can be assessed. And I want to thank, of course, my mentor, Dr. Anna Zilverstand, the lab members of our lab shown here in the photo on the right, Dr. Eric Rawls, who used to be a member of our lab, and our collaborators in Mexico, Dr. Eduardo and his student Diego. Our funding sources, and if you would like to contact me, you can follow us on Twitter or email me. My email's over here on the right. Thank you for listening.